An allergist treats, the entire family. And we know that the family line actually can transmit allergies, not just from an adulthood, but you can also get them as a child. We see very many different types of diseases. And one of those things to begin with could be food allergies. And then you've got your respiratory conditions such as asthma. They can also have just allergic rhinitis or sinus problems. Usually when we're looking at when a child should see an allergist, we really want to look at sort of your index of suspicion. We do know that by history and by need, it would help the allergist determine if you really need a skin test and further work up by that avenue of a procedure, or maybe we need to look at more medical advice. Once your child's specific allergen triggers are confirmed, we then will go through many different treatment options. One is environmental control measures, and then two, it could be medications, and then the third one would be allergen immunotherapy. Food allergies are very confusing because sometimes, we don't know if we're recognizing a food allergen, and it can be from, rashing, it could be hiving. Sometimes you can have, where actually the more scary and life-threatening reactions where you get eye swelling, lip swelling, and the airway compromise. I mean, if you've got an infant who has an immediate reaction to a food that you're eating, you want to see an allergist sooner. Diagnosing food allergy is complicated. First, we start with a good history, and after that, the skin testing, which is the most specific, and then we may actually pair that with blood testing if needed, and then we could also consider an oral food challenge. Traditionally, treatment of a food allergy requires that we have a food allergy action plan and avoidance of the food, and also access to an auto-injector epinephrine. There are many symptoms of asthma in children. Some kids actually can just have cough. But we also have kids who just wheezing, where you actually hear a whistle noise in their chest. Diagnosing asthma is mainly clinical, meaning that we do a very good history, and that history will include a family history, like the parents having asthma, and we also try to make sure that the history response of the medicines that has been previously given. One of the tools that we use for asthma can be also looking at the spirometry, which is the lung volume of a child's lung. There are many triggers for asthma in children. Your viruses, you have emotional triggers, you have weather changes triggers, and you've got pet allergen dander trigger and your inhalant. Sometimes we have patients who are on their daily medication. They're still not controlled. And uncontrolled asthma means that your child has required prednisone use or steroid use greater than one time a year, using rescue inhalers, frequently. Treatment for asthma includes your medications, that is your inhaled corticosteroids. We now have the ability to offer biologics, which are injectable medications that can provide better protection against the flaring up of their asthma.